All right, so good morning. I'm here with Andrea. How you doing, Andrea?
I'm doing well, thank
Awesome,
you.
awesome. Why don't you tell us a little bit about really kind of why you came in our office?
For a few years, I've not been feeling quite well. I mean, I've always been active and noticed how my body feels, and I just over a period of 4 years or so knew I wasn't feeling quite right and had been seeking, trying to figure out why, and came across your practice and felt like it would be a good fit.
Tell us a little bit about some of the symptoms, really that kind of brought you into our office and really kind of the impact that maybe some of those symptoms were just having on just your quality of life.
The big one for me was fatigue, and I would describe it kind of like I almost literally could describe it that my body was not producing energy. It wasn't like I'm tired because I didn't get enough sleep. It wasn't even like I could lay down and take a nap. It was just I could not really get things done. That insomnia, waking up in the middle of the night, not being able to get back to sleep, and then would lead to poor motivation and depression and things like that.
Yeah,
Low libido,
sure.
those types of things.
And tell us how long were a lot of those symptoms really going on, just going on inside your body?
I would say over a span of 4 years for sure, but there would be ups and downs. Times when I'd feel better, and then times when I feel worse. But most specifically, I would say the past 8 months or so, it really hit home because I wasn't working. And interestingly enough, I think working and keeping my adrenaline levels high with the type of work I did kept me from really realizing some of the symptoms I was having.
And so you came into our office, right? We had a phone consultation. You came to our practice. And then, if you don't mind, share some of the kinds of tests that we ran on you and really kind of maybe what some of those results showed.
Wow.
They were probably kind of surprising, right?
Right, right. There was a lot of tests. I have some medical background, so I understand a lot of it. But there was still a lot more tests that certainly any doctor I went to wasn't running.
Right.
Very extensive thyroid. I had low T3, low progesterone, luteinizing hormone. Uh, Blood sugar, my A1C was a little high. I don't. There's a I'm not sure if I can remember. Oh, metabolic pathways were
Right.
which was probably why my energy levels, part of the reason my energy levels were so low. So it was really a lot of extensive testing that hadn't been done before.
So you came in, we ran these tests, we found out what was wrong with you,
Hmm.
right? And then for those people that might be watching, this video, how would you say, like, what would you tell them about the treatment? What would you tell them about kind of the things that we did with you, and really just what treatment was like in our practice, and things like of that nature.
For the most part, I'd say treatment was not difficult.
Right.
There was dietary changes. I mean, they can be a little hard at times with social life or holidays, but all in all, it wasn't like grueling. There was supplements that were taken that are still being taken that don't have bad side effects like
Right.
medications would. So I would say the treatment's been somewhat seamless.
Awesome.
Yeah.
That's really good. And what would you tell someone, just I guess overall in terms of just your experience in our office? What would you say about either working or the phone consultations that we had, or working with Kim, or just your overall experience in our practice? So this is a chance for you to tell everybody how.
Great, great you are.
Yeah.
No, and I will probably play into that because I would say the experience has been outstanding.
That's awesome.
It really has. I mean, I had sent an email to you, and I was like, I know your office is closed on a Friday, and I wasn't expecting to get a response until Monday, which was fine, and I got a response like Saturday or something, so that was great. And I was somewhat annoying when my initial emails of, can I do this, can I do that, do this, that, and everything was answered.
Yeah.
Kim is always pleasant on the phone. I mean, just
Cool.
everything's been great.
Awesome.
Yeah.
And the last question I have for you is, or maybe I might have a couple other questions, but what would you tell someone that might be watching this video and they feel like there is absolutely no hope? I mean, a lot of the people that actually reach out to us just feel like that's it. They've been 7, 8, 9, 10, 11 different doctors, and they're just ready to give up. What advice do you have for those people?
Certainly don't give up. And I think that if you find the right place, for instance, your clinic, I think there's definitely hope. I think what happens is even though these people have seen 7, 8 doctors, they're seeing the same type of doctor that practices the same way, you know, that they don't necessarily maybe look in much deeper as to what's going on. And so I think if they just step out of the box a little bit and go to somebody a little bit different, you know, this clinic, for instance, this practice, for instance, then I think they can see some differences for sure.
Awesome, awesome. Well, I want to thank you for doing this. We're just really totally excited for you in terms of how much better you're feeling. We're really excited about that and happy for you. And I know this is really only our 10-week follow-up. This is our 10-week?
Mm-hmm.
So we have a little bit ways to go, don't we?
Mm-hmm.
And so I'm excited about just this continuous progression of you getting really healthy and just being able to get back to doing the things that you enjoy doing.
Me
so
too.
I want to thank you for doing this testimonial for us.
You're welcome. Thank you.
Absolutely.